So today I will be performing vital signs. I have a 20-year-old patient here today who's been complaining of a cough. I've went ahead and checked her charts just to get an idea of what her baselines are. So I'm going to go ahead and just get started. Come in. Hi, my name is Lucy. I'll be your student nurse today. Can I just get your full name and number, please?
Caitlin Cougar, 8/22/1996.
Okay, great.
Nice to meet you.
Nice to meet you too. So you've been complaining of a cough?
Yeah, it's been going on for about the last week or so.
Okay.
And every time I cough, it's just like a really bad pain, like right here, and I cough up a little bit of phlegm, kind of a greenish color.
And coughing up some phlegm? Alright, so have you been taking any medication for that? Or are you on any medication that I should know?
I was just taking some Mucinex, and then I take my multivitamins every day.
Some Mucinex, has that been helping?
Yeah, it's been loosening it up a little bit, but the cough just doesn't seem to go away.
It's not going away. What about your pain level? Say 10 being the worst pain you've ever had in your life, what would you rate today?
When I cough, it's about a 5 or 6, but right now it's probably about a 2, which is tolerable.
Tolerable? Okay, great. So we just want to keep you at that tolerable level. That's our goal for today. So tell me about your family medical history. Have you had, is anyone in your family have any significant history I should know of?
Just my grandparents had cancer.
Okay.
I have a cousin who has hypertension, which is, I guess, like high blood pressure or something. But my parents and everything are fine, and I haven't really had anything too major, I guess.
Okay, and do you know about how long ago was your last menstrual cycle?
About 3 weeks ago.
Alright. Okay, sounds good. So, Caitlin, we're just going to be checking your vitals today before the doctor comes in, and what that consists of is just going to be your height and weight. We're going to get your blood pressure. We're going to be checking your pulse and your oxygen saturation levels. So it'll be really quick. First thing I'm going to have you do is just step out of the room and we'll see your height and weight.
Okay.
Do you have to use the restroom?
Nope, I'm fine.
Okay, great. I'll just have you go ahead and flip your shoes off. And step on up. Okay, so you're about 180. Okay. Okay, good. Your heart rate. So I'll just have you step up facing forward. Okay. Alright, and you're about 67 inches forward. We'll just go ahead and step back into the room. Okay, so the first thing we're going to do is just take your blood pressure.
Okay, do you want me to pull up my sleeve?
Yes, please. Could you pull up your sleeve? Do you know what your normal baseline is for blood pressure?
I think like usually around 120/74.
Okay. Great. How's that feel? Is that too tight?
No.
Alright. So just go ahead and have you relax.
Okay.
Just try to just be quiet and just go ahead and sit back. Alright. Thank you.
You're welcome.
Okay, so you're about 120 over 74, which is normal. Normal is about 120 over 80, so you're in a normal range. Thank you. Okay, and I'll just go ahead and have you rest your arm out. We're going to check your oxygen saturation levels.
Okay.
Go ahead and place your index finger in there. Okay, and while I wait for that, I'm going to go ahead and check your temperature as well.
Okay.
Okay, I'm just going to pull up and back on your ears.
Okay.
Okay, you're at about 98.3, which is good. That's normal.
Okay.
So while I wait for that, I'm just going to go ahead and check for your apical pulse, which is just going to be right in here, right about your clavicle line. Are you okay with that?
Yep.
Okay. Okay. Your pulse was about 80, which is good, and your respirations are at about 18.
Okay.
Which is great. Alright, and your oxygen is at 98, which is great. You like to see about between 95 or 100.
Okay.
So that's great. The last thing I'm going to do is just going to check your radial pulse.
Okay.
So I'll just have you relax. Okay, your pulse is strong. It's about 80, which is great. So that'd be about 3. Can I just go ahead and check your other pulse? Yep. Okay, and that's great. They are the same. Okay, so is there anything else I can help you out with before the doctor comes in?
No.
Okay, so great. I'll just have you sit tight before I send the doctor in to see you.
All right. Thank you.
Okay, so if I found any abnormalities, I would just go ahead and record that in the charts and report to the doctor or the nurse. And I would just go ahead and record everything that I took, all of her vital signs, her weight, height, blood pressure, oxygen, respiration, and I would record that